speakers of the day. So our first speaker this afternoon is Stephen Vinter. He's an operations manager for the GLPMA and Laboratories group at MHRA, joining us today. And in his role as an inspector, he conducts GCP and GLP inspections of commercial organizations and laboratories in the UK and overseas, including the MHRA inspection program for organizations conducting bioequivalent studies. Now, our second speaker will be Philip Kreinstein. Philip is a team leader for the Good Clinical Practice Assessment Branch in the Division of Clinical Compliance Evaluation in the Office of Scientific Investigations in CDER. That's a mouthful. In his current position, he provides regulatory oversight for CDER-assigned bioresearch monitoring activities. And he's also served as a team leader in the GCP Compliance Oversight Branch, where he had a role in evaluation of GCP complaints. Since joining OSI, he's participated in a variety of working groups involved in developing policy and guidance, including the areas of Part 11, e-consent, use of EHRs in clinical trials, and use of mobile devices in clinical trials. With that said, I'll turn it over to Stephen.
Okay, thank you everyone. Nice to see you all. I haven't seen this side of the room yet today, so hello to everyone, and hello to everyone that's watching online at the moment. And I do believe there's a pizza party at a regulator's office in Europe tonight to watch this, so hello to everyone out there. Okay, so what we're going to try and do today is, well, what I really want to do is just really talk about effective use of audit trails. And what I really don't want is us to walk away from this presentation and have a good idea about what regulators say they're looking at, so we can then go and change our system so they can't find it. So what I want us to try and walk away with is just how we can use these effectively to try and identify problems, and then introduce some strategies that we may use, that you can use, that will help us all get better compliant and better working quality systems. So how are we going to do this? Well, we're going to look at a little bit about design, about considerations of what the audit trail is going to do. We're going to talk about control of how you manage it and then how you can make it work for you. We'll talk about review. We've had a lot of questions about, well, what do I look at? How do I look at it? And then we'll have some examples mixed in of what we've seen on inspection at the MHRA, and then just talk around some of those problems and how actually looking at the audit trail might have sorted things out before the inspectors saw it. And then we'll finish off with a case study, just to reinforce some of those issues. And I think probably one thing we can think about with this presentation is an alternative name. Is probably If Only We'd Look First, because so often we can walk in through the door, pick a study, find something, and people are just thinking, well, that was so crazy, why didn't we see it ourselves? So that's what we'll try and do. So the first few slides, rather than spend, I'm sure you'd like it if I spent 40 minutes of going line by line through ICH, but I won't. And we'll just spend some time quickly of just reminding ourselves about audit trails, about how they fit in with clinical trials and ICH and definitions, and then we can start looking at how we use them. So ICH, I went through and I just picked out some of the key points that talks about audit trails. So it talks about source data, how it's attributable, contemporaneous, original, accurate, etc. And there it is in red, e.g. via an audit trail. So ICH is already saying, well, these things might be a good idea. Definition of the audit trail, documentation that allows reconstruction of the course of events. And again, we talk about ensuring the systems are designed around data changes, so we can see what's happened, i.e. maintain an audit trail, etc., etc. And then I think one thing that I quite like about ICH now is that quality management should identify risks to clinical trial processes. And I think when we take that into account and pull it together how we can use an audit trail, it kind of starts to answer that point there of actually using our quality management system to identify risks, identifying the critical areas, and then doing something about it to minimise it and manage it, etc. And this is one we always come back to as inspectors as well. And the audit trail plays an important part of how we do this around accurate reporting, interpretation, and verification. So even if we're conducting an audit, a monitoring visit, an investigation, or it's an inspection, that verification part is quite important to us because a lot of the time, the audit trail is actually holding the key to answering that question of us actually making sure we can see what happened, when, who, how, etc., etc. So first of all, let's just think about something else and stick with me because there is some logic around what I'm doing. So if we just all think about for a moment who your favourite TV detective is. So I put some options up here, and again, your age might actually reflect of who you can remember off this. So this has been adapted from a European version. So just think about it. We've got Ricardo Tubbs, hothead from Miami Vice, Christine Cagney, sort of hard-nosed cop, Dirk Gently, one for the streaming generation in there, the classic Columbo, and then Jessica Fletcher. If you work at home, you'll know all about Jessica Fletcher and Afternoons. So my favourite in there is Dirk Gently, and it's actually adapted from a Douglas Adams book. And he's a holistic detective who actually doesn't actually solve any cases by conventional means. He just follows fate. So he never investigates. He just turns up and then just waits for fate to let him find out what the problem is. So it turns out that Dirk's psychic. Now, when you heard Andy Fisher earlier talking about his 1 in 200 hit on finding a problem in the clinical study, Andy obviously is psychic. I'm not. So there's got to be better and more effective ways of rather than following fate, of trying to get to the bottom of issues that we see. And audit trails are perfect for that because they support these activities and they can identify problems that may not be obvious. So by focusing and using this information, we can actually build up a picture of what happened and then using that in conjunction with risk assessment, with monitoring plans, with audit plans. We can actually then start to remove fate because we can start finding things before they've actually become an issue. And then, I guess for some people, finding them before the inspectors arrive and then cause an even bigger problem. So we can remember the good old days, paper. That was easy, wasn't it? Single line through, initials, what we've changed, everything's perfect. It's easy to inspect, it's easy to audit, but things have changed. Now we've gone electric. So now our audit trails, they're there replacing the paper. They're there showing us what happened. So we need to consider what parameters have been changed, what the change was, so what was said before, what was said after, who changed it, what they did, when was it changed, and also then why was it changed. And the beauty of the electronic system is this is all doing it for us. So we don't really have to worry about the classic GCP corrections because the system is going to make that record for us. Obviously, only if it's designed correctly. Then moving aside from the data and the old-fashioned sort of CRF, also there's audit trails sitting within these systems, which is giving us even more information about what the system's doing. And again, they're a really important part of what we're doing because they tell us lots and lots of more information about how the system that's sitting below the data entry is actually working. So the e-system audit trail is sitting there and it's managing your e-signatures. It's actually looking at workflows, the user roles. So it's not just the site users as well, so the people at the investigator site. It's actually tracking the data management personnel, QA when they're auditing, all these people that are looking and using the system. It's tracking what's going on. It also records when things are deployed into production. So again, it helps auditors, it helps you, it helps us to actually see when key clinical trial activities happen rather than just a paper form. And then it shows us the user access history. It shows us addition, removal of users, changes of role permissions. So you can see all this information that's sitting there that if you think about when you may be auditing, you may be inspected, these are sorts of questions that might get asked, and they're actually keeping really good record of what's going on in the clinical trial and in the day-to-day operations. So again, this is another point that has really helped as well in these audit trails, is what the actual system's doing away from the people. So it might be moving electronic data around. So again, it's just another way of just checking of the conduct of the clinical trial, of what was happening and when. Your authentication, authorization, so who was logging in and when, and those, certainly in laboratories that I inspect, it's one of the, you'll be aware of the things that we always go straight to look at when we're in your laboratory, of your user permissions and who was logging in and out of the instrument, so we could see if everything matches up of who actually did the work, and then to make sure they had the right permissions that allowed it to be done without anything untoward happening. It logs backups. So again, it just gives a record that you've got control over the data. So it also log when it's moved or it's archived. And then also the change of the system's properties. So this audit trail that's sitting below the users is also telling us as well that someone disabled the audit trail. Now, if you could do that and it was a good idea, this presentation would end now and we'd be done and we'd move on. But these are things that we need to know about and they need to be controlled. So just a very brief example, and this has been touched upon already with some of the data management discussions earlier on. So this is an inspection that I did. And we were just looking at database lock. And all of the paperwork was perfect. It had all the signatures. It was all signed off by management, that you could unlock the database and make updates. So we looked in the audit trail just to see what the system was doing. But then when we looked, the data management people had actually started work on the changes before the approval to actually unlock the database. And I think this is where we have to keep asking this question as we go through the presentation now as well, is, well, what's the significance of that? Well, if we just put it to aside the compliance, let's just think about the effectiveness of the quality system, because that is just telling me that they're not following their own procedures. So what else in the culture of the organisation is there that's making this happen? Are there other areas? So again, as auditors and as people working in this area, the audit trail is already giving us a way of just seeing what sort of compliance and what sort of attitude have we got to our own procedures. Putting it well aside from what the inspectors are going to do or give you a finding for it, it's actually there as a powerful tool to help us manage our system. So design. That's a picture of my 1993 Commodore Amiga. I bought it when I was a student because you could word process on it, but as a bonus, it was also one of the best games machines at the time, which probably got more use in that respect. When it was put on the market, it was a design classic. I rescued that from my parents' garage a while back, and it was covered in dust. I plugged it in and it actually worked and it came on. I got really excited. I was going to have an afternoon of retro gaming. But obviously, we've already mentioned it before, floppy disks. Did they survive the garage? Not very well. Some did, some didn't. But the biggest problem I had was I found my favourite game ever and it worked and I was going to play it. But I needed a joystick. And the Amiga's only got a 9-pin plug to put peripherals into it. It's got no USB. It doesn't know anything about analog. So again, I didn't expect at the time, either me or Commodore at the time, to think someone might want to use this in 25 years. But when we think about archiving now and the need to pull back data, this is just one example of design considerations for audit trails, and we're going to be able to look at this as we move further down the line. So design considerations, well, the big one is there an audit trail? And don't forget the systems one, because if it's not there, then you're going to struggle about actually getting a system that works. Does it deliver the regulatory requirements? Can we archive it? Can we control it? Is it open to abuse? So are there controls in there to make sure that it can't be fabricated? Is there adequate security to prevent people logging in when they shouldn't? And also, as I mentioned, can it be archived? So will the audit trail go with the data when it's archived? So is that connection there? And if you don't know any of these, then talk to the vendors because you're the customer. And just ask the questions of how best can this system be made to work for you to make sure that it's going to give you the information that you need. So we need to understand the outputs as well. So it's very common for a lot of systems to enable a download into a spreadsheet. So this is a screenshot of Excel. So one of the important things as well is to use it effectively, you need to know what's coming out of it. And on numerous occasions on inspection, we get given audit trails and there's several columns and we just don't know what they mean. They're just some code, they're written in some language that only the guys that built the database understand. So if we can't understand that, how can the people that need to use it in real life use it as well? So again, it's just understanding what the outputs are going to look like, whether you're looking in the system or you've got a report from it. Then understand the construction of what you're going to look at. So this is for an example of an inspection where within the live system, it was very easy to get into the audit trail via a query within the database. So you could click on as per query and it takes you straight to all the information that we expect about who changed what, when, how, what the reasons were. But as soon as the study had finished and the archiving process had kicked in, that linkage between the query and then the audit trail was lost. They were two separate systems. So then it was very, very difficult to actually reconstruct what had happened unless the actual database was redeployed into its operational state to build that link in again. And again, it just wasn't thought about during the planning and the design that actually this has got a life beyond the study, because it's quite important. And anyone that uses spreadsheets, merge cells cause you an absolute nightmare. And this happens to us on inspection. We get a huge download, and to make it look better, make it look pretty, few cells merged and centered, looks nice like that, but then you can't filter anything because it just throws all the data out. So again, if you want to use these things, I mean, it might be really, really enjoyable watching an inspector bang their head on the table when they realise they can't do anything. But at the same time, if we're going to use these effectively, QA or monitors, they just need to be able to get into this and actually use it to some sort of benefit. Now, this was my favourite slide, and then we found out we had a technical problem last night. So when I click this button, unless you've got 3D glasses with you, there's going to be a bit of a colour problem, so just bear with me on this. So transaction time. So I think we've touched on this already today, but could it be abused? So if you can enter data into a system without any system saves, can it be abused so you could actually then get the result that you want? So using a BMI example, if the system's not capturing all the changes, I'm going to press the button. So you can see with this example that you can quite easily just keep putting the numbers in until you get the answer that you want. So we're looking for a BMI under 25, and you can just merrily keep changing someone's height over and over again. We've seen this on inspection. We've seen people grow 5 centimetres, shrink 5 centimetres. So it can happen. Now, this is a very simplistic example, and even if we're not using BMI, but imagine this in a case that we heard earlier on when there's unblinding issues, that this may be a huge calculation or an algorithm that's going to make decisions, and if it's not capturing all the individual data entries, if people have become unintentionally biased, there's an ability there for them to start thinking what should happen and then start to put the results in that they think should be there. So again, it's just important to think about things like this. And again, with BMI is very simple. You could sit, I'm sure some of you sitting here thinking, well, they could just get a calculator and a bit of paper and work it out, and the system will never know. But we're not thinking like that. We're thinking about what's the best way for us and our quality management system. So I've seen this actually used in practice, where there was a volunteer for a BE study that was borderline for BMI. So we had a quick look in the audit trail because they were using the electronic system to do the calculation. The audit trail then told us that someone had just been doing what I was doing, of just continually changing the numbers until they got the right result. And there wasn't any malice there to fabricate the data. What they were trying to do was just tell the person, you need to lose a bit of weight, and if you get down to this weight, then come back. But the strength of that audit trail was that it actually told the site, this is what people are doing. This is what people potentially could do, and do something that you don't want them to do. But because they never looked as part of their process and part of their audits, they never actually picked up that this might be an issue within that department. So even something simple, if it's used properly with the right controls, can give you a lot of information about how your systems work. So control. I've been reading the book about a physicist called Richard Feynman. Won a Nobel Prize, became very famous for work he did looking into one of the space shuttle disasters, and he worked on the atomic bomb project at Los Alamos in the Second World War. While he was there, he used to do things because he got bored, and he learned how to crack safes, just taught himself how to do it. At the end of the war, he went back to tidy some work up, and he found out there was a safe in the office above that a captain owned that he'd left and no one could get the safe open, so he had a go at it and couldn't open it. But then he found out that someone actually had gone and opened it, so he found the locksmith, and he said to him, "How did you open this? Did you drill it? What did you do?" The locksmith looked a bit sheepish and said, "Well, actually, I went up there with my tools, so I didn't want to lose my job, so it looked as though I was going to go and do something." When he got there, he knew the factory default setting for the combination, and it opened the safe. So for years, the atomic secrets of the West had been sitting in this safe, that if you knew the combination, you could get into it. Now, that's no different from I've been on inspection where a colleague's Googled the manual for a software system, found the administrator default password, and lo and behold, you can get in and start changing audit trails the next morning. So all these little things that can creep up on us and cause us a problem. So how do we control it? Well, we've got security. So we've seen now, and we've heard it several times today already, shared logins. You just can't attribute anything to anybody. And then if you've got no control over access permissions, so multiple users can log in, delete, amend audit trails, and you haven't got a clue who's done it. Archival, touched on that already. But again, audit trails, we had an example where they weren't archived with the database. Then also when we investigated a little bit further, that the vendor actually, once the clinical trial had finished and the contract ended, the contract said the vendor would delete the database. So all of this would have been lost. Then obviously, the control needs to be there to make sure that there's no abuse. So is it open to abuse? Well, it could be. So this is from an inspection. We were looking at the laboratory analysis for a PK study. So we identified some issues. So we were trying to verify the conduct of the laboratory analysis. And we actually found that 6 months worth of audit trails were missing. So we had doubts about the conduct of the study, and then when we wanted to look what the instruments were doing, that 6 months when that study had been run had gone. The lab couldn't explain it. They were very nervous about the questions we were asking, and then we went and looked and it wasn't there anymore. So that's the only conclusion that we could come up with, that there'd been a deletion by an administrator that had then removed all record of that study analysis, which ultimately led to us raising some actions against that company. So again, that control, there was nothing there to control the access rights, so we couldn't see who'd done what and actually look at what was going on within the system. So review of audit trails. I've got a great audit trail at home. It's my bank statement. If I got a bank statement every month with no details of my transactions, just saying, don't worry about it, we've got the best banking system in the world, you just have to rely on that number we're giving you every month, I think I'd be a little bit worried. And we should treat our systems the same way. And certainly I'm not going to come to an inspection and you say, don't worry, Steve, the data's fine. I'm going to want to see, and we should be asking those questions ourselves of how we review our audit trails. So how can we do it? Well, we can look in the system. So all of the e-systems we've got, with certain access rights, you can get in there, you can click on links, and you can see who's been doing what behind certain data. So for the people involved in bioequivalence, when you're looking at integration of chromatograms, you can go straight to the audit trail of how the data's been processed and then how that result has been generated. We can do it via reports. So again, in some systems, a lot of electronic data capture, you can run reports within the system, you can look at the audit trails, or you can do downloads like we've seen with Excel there, that you can pull data out and then you can start looking at it and you can start just seeing how you can detect any trends or issues. But then probably the most important thing is maintaining the dynamic data. So an Excel spreadsheet printed out as a PDF isn't an Excel spreadsheet anymore. The audit trail isn't particularly an audit trail anymore because you can't work with it, you can't interact with it, you've just basically been given a piece of paper. So again, that's another important concept. If you want to use these to do what you need to do, It's making sure that the data's in a format that you can actually work with it. So big data. What can we do? This is based on an output from some of the big pharmacovigilance databases. So very oftenly we can request these on inspections and we end up with thousands upon thousands of lines of audit trail. But once you've got it, you can actually then start to use it. So in this example, we could be looking at adverse events. We might be doing an audit on case reporting. We might be wanting to look at a particular site. But then just by looking at the data, we can start to use filters. We can start to look at events. And we can really sort of zoom in on a particular topic that we're looking for. So in this example, we can see we've got adverse event assessment. We've got a bit of a disagreement between a Negan and an R. Grimes there, that one of them keeps saying it's either related or not related, then the other one keeps changing it to the opposite one just afterwards. So that might then sort of suggest to us that do we need to just have a little bit more, bit of a closer look in that area or that part of the operation, that is that actually happening, or have we just got two people that don't get along here and they're just trying to wind each other up by changing their assessments? That's very simplistic, but you can see the power of just being able to use the data to support an audit or support a particular process that we're looking at to then make it work so it can actually help us get through 10,000 lines of information to actually use it effectively in a positive way. Another example, so on inspection, just looking at a data audit trail and saw a systems engineer logged into the system. There were no changes to the data, but then when we looked at the source data, it had been corrupted when it was removed from the archive. So this company, their archive process was burning to DVDs and putting it in a safe. They'd got the data out of the safe when they knew we were coming just to make sure everything was all right. And then they'd realised that actually there's a problem with it, called the systems engineer, who then logged in to try and fix it, couldn't fix it. So in time-honoured tradition, decided not to say anything and hope that we didn't spot it. Now, Andy wasn't there, but site inspection kicked in again, and the first records that we chose, we couldn't open it. So the site hit the panic button, but then after we talked to them, we were able to get the data back via going back into backups and looking at other the archival copies. And eventually they changed their system to just the way they archive, just to stop any issues with the media that they were using. Now, we found that on inspection, but again, it's just thinking about the use of the audit trail of just how, by using it in any audits that they may do or any investigations, that they may have picked this up and then identified that there was a bug in the system that then created this sort of problem. So when do we look? So again, we consider the risk and what's the purpose of the system and the data, what's a suitable level of review and how often. So you have to ask these questions yourself. There's no one answer. We can't say look at it every other Tuesday. You've got to really understand your system and identify where the risk is and then decide what the level of review should be. And how to do it? Well, look, normal oversight activities. So you can build it into audits. So if you're, like say, if we're auditing adverse event reporting, you can actually look in the audit trail and just pick some and just look what's happening. Or by incident. So if we've got a non-compliance of just using the audit trails to check what's happened and then to rebuild what was going on in the study. So they're an important part of quality management, and the more we embrace that, the easier it's going to be to improve our systems. There's potential risks, that need to be identified of when to look and how. You can look at single data points, you can look at big reports, incident investigations, they're all sitting there. And also controlling access and archiving the audit trail just preserves all of that meaning that can potentially be lost. So it's a very bit of a case study here. Now, when this happened, the inspector who found it was on the phone to me for an hour trying to explain it to me. So I've tried to make this into something I understood, so hopefully we can all get our heads around it. So this was an inspection of an analytical laboratory. And during the inspection, we found that the final report study data didn't fully reflect the source data, so there was a difference between what was in the report and then what actually happened at the lab. It included data and information for work which hadn't actually been conducted as part of the study. And this was all identified via looking in audit trails ultimately. So we'll just walk through how that happened. So this is the system. So there's a data generation acquisition system. So the computer, the instrument that's doing all the work. So that generation's got an audit trail. Then there's a data processing system that takes the data and then gets it ready to put into the report, which also audit trails, and then it gets finally moved into the clinical study report, the analytical report at the end of the study. First of all, the company didn't have any procedures of how data generation software, including the audit trail, we managed, archived. And also the audit trail for the data generation software wasn't reviewed as part of any audit, any inspection, or there's any detail if they did do it, who'd be responsible. So there was a gap in their systems that they didn't look. And there was nothing there to control how they would look. So these are all the subjects that were analysed, and our inspector took a look at this. Straight away saw that subject 2 and 3 were actually repeated. So they'd been analysed once, and then a few days later they'd been analysed again. So we looked at why that happened. So initially, what was wrong with it? We looked in the audit trails for the subjects 2 and 3, and it confirmed that they'd failed. So there was justified reason to repeat as run 42. But the data generation audit trail for run 42 wasn't in the system. So data had been generated for the first run, but then the repeat run, even though it was in the report, the system was saying, I never generated anything for run 42. So that obviously set some alarm bells ringing. So first of all, the inspector, he just went into the system, and the thing that leapt out of him was that all of the file sizes were very similar apart from run 42, which was significantly smaller than the rest. So something wasn't right. The data package was completely different between run 42 and the original analysis. So next, they kept looking and looking, and we all know that 42 is the answer to everything. And in this case, it was. So by looking more into the audit trails, things started to become a little bit clearer about what had actually occurred. So when we looked in the data processing audit trail, the second step, if you like, that was actually saying that run 42 had been manually created. So the super user had actually logged into the system, pulled certain data from the first run, and then put it into a new run 42. So straight away, the fraud alarm bells are ringing about why would anyone want to do that and create run 42. So that then prompted more questions, more looking in audit trails, and just trying to find out what was going on here, because run 42 was in the report. So what actually happened was that everything looked fine in the report, run 42, there it is. What had actually happened was the actual laboratory management system was set up for the right reasons in some way, that if something failed, the system wouldn't let you close the study with failed analysis not being retested. So it's trying to stop people from reporting things that had failed. But the problem was the lab couldn't repeat. They couldn't actually do run 42 because there wasn't enough sample left. So they couldn't physically do it. So rather than raise a deviation and start putting CAPA in place to fix the system, I had the bright idea that just to satisfy the computer, we'll create run 42 so then it thinks it was done, and then we can close the project and raise the report. So there's no impact on the final results, but fundamentally that it didn't reflect the conduct of the study. The quality assurance department didn't know a thing about what was going on because they didn't audit and no one had told them. And also from a regulator's point of view, that the way they were working actually gave an opportunity to actually commit fraud. Because even though this was, like, should we say, honest, maybe, it was an attempt to pacify the computer system. In another scenario, it could have been used to actually put falsified data into the reporting system. So I think this was really interesting in that, would they have spotted it during a normal audit process? I think there was probably a strong possibility, because generally if you're looking at risks to data, repeat analysis is a good place to start, just to see why something was repeated. If they'd have looked in the audit trail, they would have started to see that things don't quite look right, and hopefully they would have followed the same path of this just really shouldn't be happening. So it was a really good example that where we used audit trails to raise findings, but at the same time the lab could have quite easily have picked this up months ago and probably changed their processes to control it. So it all came down to the missing audit trail, which just wasn't there, which then triggered the looking at how Run 42 was actually reported. The irregularities in the file sizes just didn't look right. Then we came across the inappropriate use of the super user privileges, the lack of controls and gaps in the audit coverage, which allowed this to happen. And then probably the big one, and when we're talking about the effective use of audit trails, is that the limitations with their system. Their system was managing them rather than the system working for themselves. And that they'd become so blinkered into trying to pacify the computer that they just forgot about what they were doing, and the computer should be there to give them and help them conduct their studies. So to me, that's the real capper in this, in that they should have been looking then, well, our system's wrong. We need to change the system. But instead, it was, right, okay, let's get the crowbar out and let's try and force something through the system so it's happy, because we don't want to upset it. So, some questions as part of the effectiveness of the learning. I hope we can all walk away today. We've learnt about nuclear bombs, my Amiga, my parents' garage, but more importantly, I think if we can leave here and just think about when we're going to our audit trails that either we're using or we're planning to use, are we really maximising their use as a quality tool? Are they there because we bought the system and we didn't really ask for it, but it comes with it because it's the regulatory package? The inspectors expect us to look at it and use it, so yeah, we'll tell them we open it up. But we've seen it can be used for so much more, and it can actually help us and help us have better systems and better organisations. And I'm sure none of us would get on a jumbo jet if we thought, well, they've got all this information, but they never look at it, or I wonder if the black box is plugged in. So, and again, are they secure? Can the super user, with their privileges, go, slip in through the back door and make all these changes? So it's not really apparent until we start looking really closely that something's wrong. Then do we understand the content of the meaning? When we looked at some examples earlier on, the headers on some of the columns that we were reviewing, I didn't really know what they were, and you almost end up second guessing what's there. And again, what does it mean when you look? And certainly some systems are that complex. Certainly a systems audit trail will download every single thing it's doing. So you can end up with thousands and thousands of lines that you don't really understand what it's telling you. So again, it's just using the vendors, using the information that you've got just to pick out the key fields or forms that will then actually tell you the important things that you want to know. So logins, changes to administration rights, data moves, archiving steps, all these things should be clear that you can then use using the big data approach of being able to filter and get information out of it. And then strategies of how to use these. We've already seen there's lots of different ways that you can, the moment you have a problem or an investigation, they should be one of the first things when you've got an electronic system that you're using just to double check what happened. Or using the strategy of just taking a download of the audit trail over a particular time period, of then just, okay, we're going to use this to support our audit. We're going to use this just to see who was doing what. Our SOP says we can't change any of the data until it's been approved by management. Well, use the audit trail then to actually look, well, when did they unlock it? Did it match with our procedures? And then use it just to help support and drive the quality culture. So all these things, I hope we can ask ourselves, and when we leave, and then we can think, okay, let's just go back and think about these, and should we actually change the way we use this within our system just to help us be better, rather than go in the route where we've got them, we'll have a look every now and then, but then we start asking ourselves that question, and next time that we get the FDA or the MHRA or any inspectors from any regulatory agency come and start digging, and you're sitting there thinking, I wish we'd have found this before they did, because it would have looked a lot better if we'd had our CAPA lined up and shown them how good we are that we're fixing this, rather than we thinking, well, they're only here for 3 days. If it takes a day to get it out the archive, then maybe they might not spot it. But that doesn't help anyone, because ultimately we're all here to try and improve public health. And by being open and being able to address these, I think it makes all our lives a lot easier. So that's me. Any questions about the Amiga 1200? I'm available from 5 o'clock, but thank you very much, and I'll hand over to Philip. So thank you.